Hey everybody, it's your girl Chere Goode, the Recharge Strategist, and we are here live at the Recharge and Go Red event geared towards heart health, especially for women, because we know that 1 in 3 women die annually from heart disease. 1 in 4 men die annually from heart disease. It's definitely a topic that we need to discuss more often. Did you know that women are less likely to receive CPR if they are not with a loved one and they have an event when they are out in public? Yes, these are some of the juicy topics we're going to be talking about. So we're going to have the heart health panel. So I'm going to turn this around so that we can start to ask our guests some questions and have them chime in so that you can learn something today about heart health. February is Heart Health Awareness Month. And so we're trying to get as many people in the know about how to protect their heart as possible. Thank you, Wendy. Thank you, Letitia, for tuning in. I'm going to turn it around so you can see my panelists for today. Hi, ladies. How are you?
Hello.
Good. I'm going to let each of you just tell who you are and something quickly about yourself. We'll start with you, Delayna.
Sure, absolutely. Well, hello everyone. I'm Delayna Watkins, and it's a pleasure to be here, Chere. Thank you once again for this much-needed event. I am a nurse by profession. All of you probably know me as the Wellness Maven and the Sugarless Diva. So it's my pleasure to be here to share some information about heart health.
Yes.
Hello, my name is Pamela Williams, and I am a co-host of a radio show entitled A Different Identity with my male counterpart, and I'm here to share my own personal health story.
All right.
Hello everyone, Tracy Newsome. I'm also here to share my own personal story. I am a health coach and I'm looking forward to sharing with you.
Awesome. And we'll be joined shortly by Denere Hilton. She'll be here. She's en route. Queen D, as many of you know, and she's going to be talking to us later about the importance of physical fitness when it comes to heart health. So Delayna, since you're on the end, I'm going to start with you with the first question.
Sure.
From a nurse's perspective, what are some of the main symptoms that people oftentimes ignore when it comes to heart disease?
Oh, that's a loaded gun right there,
Right.
literally. It's a loaded question because sometimes heart disease can present itself very much differently in each individual. But usually it's not that, what I call the Hollywood symptomatic that you may see. All of us may remember growing up, maybe watching Fred Sanford when he would grab his chest
Right.
and sort of do one of these numbers, and it's like that. It's really not always a crushing sensation that you may experience, that whole elephant sitting on your chest type of thing. Sometimes you may have symptoms of, sweating profusely, pain radiating down your arm, different things like that you may experience outside of just the norm of having that crushing feeling or sensation or the tightness in your chest. So my thing that I employ to individuals when you're thinking about symptoms of heart disease or knowing is starting with knowing yourself. When you feel that there is something different going on, shortness of breath when you're walking, when typically you can walk a block or up a flight of stairs without getting short of breath, just be aware that there may be something going on. So it may be 1, 2, or sometimes all 3 symptoms together that will then let you know you're having a cardiac event.
Yeah, and especially with women, the symptoms oftentimes can be different with women than with men. Men typically get that chest pain.
Right.
Women, it can be nausea and vomiting. It could be jawline pain. So that sounds like other stuff that you could be having, right? And so that's why a lot of times people say, oh, I'll be fine, and they continue on with their day, but don't ignore the signs, especially if they are lingering for more than an hour. So, you may want to start to hit on what to call 911 or seek medical attention. So I think that's important for especially women to know. I know I used to be an instructor for CPR. And one of the funny things that they showed us was this lady. She's in the middle of a heart attack, y'all. She's in the middle of having a heart attack. She's cleaning the house. She's packing the baby bags. She was more concerned about 911 not seeing the house dirty than she was about having her heart attack. So she didn't have time for a heart attack, y'all.
Exactly.
So, it just shows
The
that
situation wasn't right for her heart attack.
the situation wasn't right.
The situation wasn't right. It wasn't time for her to have a heart attack. Her house wasn't clean.
Let's put the heart attack on hold.
Right. Let's put the heart attack on hold.
Wait a minute, hold on. Right. Hold on, not yet. Wait a minute.
Yeah. So, if you know something's not right with your body, definitely seek medical attention. I'm going to head on over to Tracy. Pam, we're going to come back to you because you got a good story, juicy story. We're going to wait for Pam in a minute. Tracy, so a lot of people don't relate diabetes to heart disease. Can you speak on that a little bit and tell us the correlation between the two, or why they are associated at all?
Oh, absolutely. So diabetes and heart disease, as you stated, go hand in hand together. Heart disease is actually one of the complications associated with diabetes. We say good diabetes care, you start with the ABC. One is is your A1C, which gives you your average blood sugar over a 2 to 3 month period of time. B is for blood pressure. So you want your blood pressure to always be in check, because blood is the force of blood pressure is the force of blood in your blood vessels, right?
Yep.
And if your blood pressure is high, then that means your heart is working really, really hard. So we want your blood pressure to be controlled. And then the C is for cholesterol. We have the HDL, which we call the heavenly, that's the good cholesterol. And then you have the LDL, that's a low down. We don't want that. So you actually want those three things to be in check, because those three things are all related to your heart.
Yeah.
And when those things are not controlled, then you have increased your risk of developing a heart attack or a stroke.
Yeah, absolutely. And then Delayna, I know you and I were at another event earlier today, and you talked about the 3 Bs. Tell us about the 3 Bs again. That a couple of them Tracy just touched on.
Touched on them. And again, the 3 Bs are your blood pressure, your blood glucose, and then your BMI. So it's very much similar to what she was saying, and that is again understanding your blood sugar, not having that be elevated if you're pre-diabetic or diabetic. And that goes along with the A1C, as Tracy said, gives you a look back over a 3-month period. And then your blood pressure, and Tracy did an excellent job also talking about that, meaning that if that pressure that's being measured in the blood pressure is sky high, then it is the force of your heart working that much harder. And then the last B, which is your BMI, again measuring your height and your weight, giving you that index number to determine whether you are at your normal body weight, above weight, which would be overweight, or obese. And then obesity has 2 and sometimes 3 classes depending on where you are. So you have obesity class 1, 2, or 3. And so if your BMI is 25 or below, then you're sort of in what we call the safe zone. Anything over 25 becomes a concern, and definitely over 30 is where you get into that class of obesity.
And I liked earlier you had mentioned the blood pressure. For people to really understand what that number means, tell us that again, because that was really good.
So I always try to give a visual, and what I spoke about earlier was imagining trying to push pressure through a garden hose, and there's a kink in the garden hose. The amount of force that it would take to get that water through and then on to the other side. So sometimes cardiovascular events can be just that, is that the arteries and your vessels may not be working, or they may be filled with cholesterol or atherosclerosis, which means that they are smaller. And so you're trying to get this force through a smaller hole, and then that's where the blood pressure backs up and you're not able to push it through. And so the visual that I like to use is imagining trying to push the amount of force through a garden hose when it's kinked, or the force that you're putting through won't fit through that hole. So
exactly, I just thought that was a good example to make somebody really appreciate, having high blood pressure, and have a visual of what, what's going on with the blood pressure. What does that mean? Absolutely. Again, 1 in 3 women and 1 in 4 men die annually from heart disease or heart attack. Every 80 seconds, someone dies from heart disease. 80 seconds, that's a minute and a half. We've been talking longer than that.
And the 1 in 3 would be this panel.
And the 1 in 3.
So it would be one of us could potentially be at risk.
That's right.
And then die annually from that disease. So that's how, the risk is for just a small population of just this panel of us being at risk.
And just because you have heart disease doesn't necessarily mean it's the end all. And that's what I'm going to focus to Pam.
Yes.
Pam, tell us, I'm just going to let Pam just tell her story. Pam, walk us through you receiving your diagnosis of heart disease, and then the treatment that you had to receive, and how your life has changed since you were diagnosed and treated.
Okay. So my story goes back to 2016. I was a high school teacher, and I was walk up the flight of steps, and when I would get to the top, I would be the breathing was different. And so students, other teachers were asked, "Are you all right?" And I said, "Oh yeah, it's probably just asthma. I'm just having an asthma issue. Should be all right. Let me get my inhaler," and I would puff it and sit down. Well, one day it got really excessive. I couldn't talk. So I couldn't even teach a lesson. I had to switch it over to my student teacher. And so I said, well, let me just call, look, I'm dedicated. So I said, let me just call urgent care and go on my planning period, and I'll be back.
See?
So I went on my planning period to urgent care center, and I said, "Oh, I just think it's my asthma acting up. Can you just give me something, a steroid for my asthma?" And she listened, and she said, "I don't hear anything with asthma." She said, "Can I do a EKG?" And I said, "Oh, absolutely, please do it. You know, I know it's nothing gonna be wrong."
Right.
And so she did an EKG, and she said, "You need to go see your doctor yesterday." And I said, "Okay." 2 days. I wait 2 days. I said, "Okay, I'll call and see her." 2 days later, I go see my primary. She sends me immediately to cardiology after she looked at the strip, and she said, "You need to see them now." They send me to cardiology. They schedule me for tests immediately. Monday, so that was on a Friday. By Sunday, I literally I could not walk from my room to the bathroom.
Wow.
My breathing was so labored, and they rushed me to the hospital, and I literally fell at the desk once I got in. And when they checked me, I ended up in the hospital at that point for 8 days. During that 8 days, they discovered I had a blood clot in the left ventricle of my heart.
Wow.
They found out that my heart was only beating at 24%.
Wow.
Pumping. And then they also discovered and said I needed a heart transplant. I was devastated. And so then everything was put on hold in my life. So I could not walk. I was totally dependent on bed rest until they decided next steps. I heard during this period, it was about a 2-month period when they were trying to prepare me for a heart transplant. And I just was like, "Lord, I don't want a heart transplant. That's not, I know, this just can't be right." So I decided to go with a second opinion. I went to another hospital, got a second opinion, and saw a great physician who I love. And she put me on medications, but she put me on 18 medications a day. The 18 medications a day, she said, "I don't want to immediately push you towards a heart transplant just yet. Let's see what the medications can do." And so she put me on the medications, and I went back to work that year. So I was off all summer, and then I went back to work in September. And I was still having issues because then my diabetes went crazy. So then I started having diabetes issues where I was going to work and my blood sugars was like 300 and 400. So my body started totally going crazy once the heart stuff started going crazy. So by 2018, I started having chest pains again because she said, "Well, let's keep you on the medications for a year. Let's see what happens." In a year, my heart got up to 44%. So she said, "Okay, good. It's going in the right direction. Diabetes was in control, and everything was starting to come back into focus." And then she said, "Well," I started having chest pain. And she said, "Well, let me just give you some nitroglycerin to keep at home. So in case you do have some chest pain, take a nitroglycerin." So one day I took it, and she said, "Well, did you get relief?" And I said, "Yes." And so she said, "Well, come on in. Let's do a cardiac cath just in case." So she did a cardiac cath, and when they did the left cardiac cath, they discovered that I had 2 major blockages, a 98 and a 99%. She said it's a wonder I had not died. They took me in on September 5th, 2018, and I had a triple heart bypass. And since then, actually, my body has been wonderful. My heart is still at 44%, so they still consider me congestive heart failure until you get to 50%. They can't say why I ended up with heart disease, because although it runs strong, I realized on my grandmother's side of the family, it skipped all her siblings. I mean, all my mother's children, her siblings. None of them had any issues. So now I struggle with, well, I don't struggle a whole lot now. I do pretty good. I just don't know my limits because I still want to be paying. Because I feel like I'm young enough that I still want to live my life. So now my eating habits have changed dramatically. I don't eat fried foods anymore. Everything is baked or grilled or broiled. I eat a lot of salad. Well, today's my birthday, so I'm doing some cake. So I'm doing some cake today, but I sort of limit my sweets.
Right. Yep.
So it is a big lifestyle change.
Mm-hmm.
It is, but you can live through it.
Right.
And I guess I'm the example that you can.
Mm-hmm.
I might have this gigantic scar there on my chest, but it's my badge of honor right now that I'm still here.
Yep.
So I guess I am living proof that you can live after
Mm-hmm.
heart surgery, open heart surgery, because my surgery, that was another thing. My surgery was only supposed to be 3 to 4 hours, and it ended up being 9. So, just another example of me just living through life.
And Pam, if you don't mind sharing, how old were you when you got your diagnosis?
45.
45. So the stigma that heart disease is for old people is thrown out the window these days. So again, as Delayna said, listen to your body. You have to listen to your body. If your body's telling you something's wrong, then there is something wrong. We got Queen D in the building. We're gonna have you take your throne on up here. So we're doing this live so that we can share with as many people as possible. And so as she gets situated, Delayna,
Absolutely.
what are some of the other things that we can do? I know we talked about diabetes. What are some of the other things? I know you teach sugarless living. What are some of the other things that people can do to, aid in their heart health?
Well, I am going to let Queen D, when she gets situated, tell you all about movement.
Right.
I will just mention movement, whatever that looks like for you. And so that's why I don't say exercise. I say movement. Movement comes in many forms, many facets. And so my sis over here, Queen D, is definitely going to let you all know what the importance of that is and what that looks like for you. Because again, we want to allow our hearts to get out of a resting state, which means, you know how we should say couch potato or more being sedentary. We want to increase our heart rate to get into that fat burning mode and elevate your what's called a BMR, which is your basal metabolic rate. So when you exercise or when you move, you should, at the end of it, not be able to talk to me and hold a conversation. You didn't do anything, okay? So when you are moving,
if you're not saying, "Oh Lord Jesus, let me sit down," then you're not doing nothing. Oh, okay.
Or if you ain't doing a woo, if you ain't doing one of those,
you're like, woo.
Don't talk. You need to do a woo at the end. Then you have absolutely increased your heart rate. So I'm gonna let Queen D share about that with that whole movement.
I also say singing a song. You can sing a song.
Right. You can sing a song. Keep it pumping.
You pump it up.
I'm a piggyback off of that.
Okay.
Yes. Right.
That's
That's
right.
Also,
Come right
because
in.
movement, it only takes 15 minutes
Bam.
a day to get your heart pumping and healthy. 15 minutes, not 30 minutes, not 45 minutes, not 60 minutes. 15 minutes. Moderate exercise. Walking. Going up and down the steps. Moving your arms, your legs. And also when you are moving and exercising, singing. Sing with it because because it actually increases your heart rate and all, and it increases your, get going a little bit more. Even just moving your arms. Just moving your arms. If you're sitting in a chair at work, just move your arms. 15 minutes to get your heart healthy. And I'm going to say this too, just not even about movement. Just about being pure and healthy spiritual wise. Inside. You stay positive, no stress. Just, surrounding yourself with healthy minded people. And I said healthy minded people.
Yes. Say it for the people in the back.
Surround yourself with healthy minded people and your heart will take care of you. Will take care of you, take care of your mind, your body. And I tell people all this time, especially when they come to my class, I always tell new people to come up front and I tell them, get in line and I talk to them.
I was one of them.
I don't.
Girl, me too. We all been there with Queen D.
Okay, so when I sit now, so what I'm about to say, you can actually vouch for me because I will tell them this. I don't care who class you go to. I don't care how many times you walk around a lake, how many times you walk around a track. I don't care what you do as far as moving and trying to lose weight. Fitness and health. Fitness is about being healthy from the inside. Absolutely. You keep that inside healthy, it's going to take care of that outside for you. Absolutely. And I tell people that all the time. It's just not about the outside. It's just about your inside. And you keep that inside healthy, man. I'm telling you, your heart gonna beat.
Right. Yeah.
Not only that, I tell my students this too. I always tell them, put the hand on it right here. Where you feel.
Right.
And they say heartbeat. And I say, yes, purpose. That means as long as that heart beats, that means God has a purpose and a plan for you.
Yes.
You know? So as long as it's beating, you know, you got it going on. You're blessed. You're blessed. And by doing that, you're going to stay moving and you're going to stay, you know, more healthy as far as like it being happy.
Absolutely. Right. And that's that internal. And that's the other piece that she talked about in the stress.
Yes.
All of that. So again, that what you put on the inside will manifest itself on the outside.
Yes.
So the
it
mindset,
does.
like you said, surrounding yourself with healthy people, if we're doing that, it puts us in the right frame of mind to, like you said, push through your purpose.
Yes.
Regardless of what you're feeling.
Yes.
And that was a mouthful.
Staying positive.
Staying
Yes.
positive. Yes.
Yes.
Surround yourself with girlfriends that's doing things. And I tell people this too. Surround yourself with people who are doing better than you.
Yes.
That's the
You
word.
know, so, but people probably thinking at home, what that got to do with health? Heart health.
Oh,
A lot.
A whole lot. Yes.
We're being educated right
A
now.
lot.
Yes.
A lot.
We're learning from each other.
Exactly.
From all walks of life.
That's
Here,
right.
you know, just the four of us here on the panel, from all walks of life, adding and pouring into you. And again, as she says, surrounding yourself with like-minded, healthy, like-minded. And that goes back to what people say about toxic people. You hear people saying that a lot about toxic people.
Right.
Well, it's so true. And that's the thing is that you don't want to eat toxic food, so why surround yourself with toxic people?
Because
Right.
you know what happens when you surround yourself with toxic people? It stresses you out.
Yeah, exactly.
You know, it stresses you out. So what does that do for your heart?
Absolutely.
Stress your heart out. You know, my dad, he passed away in 2017. He had heart disease.
Right.
Okay. His wife passed away 2016, a day after Christmas. Okay. Suddenly. Okay. We always knew Dad had a bad heart. He had a stroke in April. Okay. So he never really recovered, but he kind of sort of did. But then next year he just started going down and going down and going down and going down. Long story short, he passed, and they told me, your father had a depressed heart. So I'm like, what does depressed mean? Yeah, like what does depressed mean? And I never asked the doctor, but the first thing I'm thinking, depressed meaning his feelings and things like that. Of course, he missed his wife. His wife was his heartbeat. You know, his wife was his all in all. And what happened? Truly, I went back and looked at his death certificate. It was this long word, I can't tell you. And I Googled it. Yeah, depressed heart. He died. What's that syndrome?
Yeah.
When somebody.
It's like pulmonary
broken heart syndrome. It's broken heart syndrome. And I'm saying this because he was depressed. He did not want to. I said, Dad, come on, let's go walking. So
He
I
lost his stride.
Yeah. So, you know, I was, come on, Dad, let's go walking, let's go. He didn't want to do that. He just felt like, I'm just going to sit here and watch you. But come to work with me. I'm just going to sit here and watch you do your thing and everything like that. And I even came up with a fitness exercise.
Right.
Called Chere Fit.
Chere
Where you
Fit.
can sit
She was at my church. Coordinator Baptist Church, and she was doing those Bel Air and White. Oh yeah. Before you moved up on the road. Absolutely right. And
the parking lot situation.
We got a big parking lot, but no, it's just too big for all this movement here, which is good.
Yes.
Again, for the heart. As you stated, the stress it pulls on that broken heart, being around toxic people, BMI over 20, all of that pulls on the heart. So we need to make sure that we're moving, and Lord knows, Queen D will get in your face.
Yes.
And, you don't have a choice, but it's good for you.
But the whole time I'm in your face, I am pushing you.
Yes, you are.
Come on,
That's right. You
encourage.
You encourage us. Absolutely. Because we know the benefits of movement.
Movement, definitely.
The blood sugar, blood glucose. It lowers our cholesterol, right? Lowers our blood pressure. It makes us feel good. Wait a minute. Look good.
Right?
Wait a minute. Yeah.
And you know, and I'm telling you, when I went to the doctor, this was probably like 2 years ago, and they said, "Oh my gosh, my blood pressure." She said, "Your blood pressure is really low." I'm like, "It is?" She was like, "Yeah, it's really low. So I'm just gonna you sit right here, and the doctor's gonna come in and talk to you." And I'm sitting there crying and everything. I'm like, what's going on? He said, "Well, did you tell her what you did?" And I said, "No." He said, "That's
why your blood pressure's low. Movement, definitely. Yes.
Movement. Exactly.
Yes.
Move, shake something, stay healthy,
Yes.
all that good stuff. I'm telling you, your heart, the inside will take care of your health."
That's right. For everybody who's just tuning in, thank you for tuning in. Hey, Sherwood. Hey, Tina. Hey, Madeline. Hey, Rhonda. Hey, Ramunda. Hey, Tawana. Hey, Andrea. Hey, Venus. Hey, France. Hey, Wendy. Letitia. Thank you, guys. Look, our panel is in the building. Look, I know how we like our shout-outs, y'all, so I'm just shouting everybody out. We're here at the Recharge and Go Red Heart event, just chatting it up with our panelists. They've been dynamic so far. 1 in 3 women die annually from heart disease. 1 in 4 men die annually from heart disease. Every 80 seconds, someone dies from a heart attack or heart disease. Don't be a statistic. We're here to get you in the know about things that you can do to improve your heart health. Queen D is here talking about movement. We have Tracy Newsome here talking about diabetes and how you can control your blood sugars, and that's going to directly correlate to your heart health. Pam is here as our dynamic survivor. At a young age, she was diagnosed with heart disease. She's had a triple bypass, and look at her. She looks like a picture of health, right, y'all?
And today's her birthday.
And today is her birthday. So we are here celebrating women, celebrating heart health. Then we have Delayna Watkins, the wellness maven, a.k.a. the sugarless diva, who's a nurse also, teaching us about how to just stay well overall. As I mentioned earlier, Delayna and I had an event earlier today. We talked about heart health, and we were just talking about how you have to take a mind, body, spirit approach to everything when it comes to wellness. It's not just about one piece of you. We are a whole puzzle. Think about the puzzle, mind, body, and spirit. If you put a real puzzle together and one piece is missing, bent, flawed, you don't get the whole picture, right? The picture is missing. You're not whole. The same with your body. If mentally you're not whole, if spiritually you're not well put together, if physically you're not well, you're not whole. So we have to make sure whatever part of us is broken, bent, needs some extra work, put in the time to perform the self-care to make sure that you are complete and whole. We want you around for a very long time. I'm going to let each lady just give us some final words of advice towards heart health and just overall wellness.
Absolutely. Well, again, everyone, I always say know your risk. Everyone has a heart, so start there. So we're all at risk for heart disease because we all have a heart beating inside of us. The difference between you and the next person is whether or not you know your risk. So that's a very important part of it, is knowing your risk and then understanding that you do have control to do some things about those modifiable. There's certain things that we can't modify. You can't modify the fact that you are an African American female, for example, or that you have a history of cardiac disease, but you can modify whether or not you're eating healthy, moving, and understanding your numbers and making an impact that way.
And tell everybody how to reach you.
Absolutely. You can follow me on all social media at Delayna Watkins or the Sugarless Program.
All right. Over you, Pam.
Hello. So I would like to say know your body, because we always underestimate ourselves. So we will feel something and be like, oh, that ain't nothing. Or we're so busy taking care of other people that we don't take care of ourselves. So we put ourselves last. So I would say pay attention, because just like Delayna mentioned, when it comes to symptoms, one thing the doctor said to me during the course of my treatment when I first went in was I had a heart attack internally. So I didn't have the feeling that people normally get. It happened internally and I didn't know it. So when you feel like you're not right, you know when you feel right, do something about it. Go to the doctor. Take your medicine. If the doctor gives it to you, take it. Don't just stop taking it on your own, because you'll end up in a worse situation. Just follow your heart.
And tell everybody how, I like that, follow your heart. Tell everybody how they can get in touch with you or stay in contact with you. I know you have your radio show as well, so plug time.
Okay. So you can find me on my website at pammintz.com, which is my maiden name because I just got married.
Hers married now. Her married now.
Married now. And,
glowing.
and you can find me on Facebook at Pam Williams. You can find me on Instagram at PrettyGirl3018. And you can also find the radio show page, a different identity radio show page where we have fun 365, 24 hours a day. So please come and send an invite because we have fun on that page with all types of topics.
Yes, if you follow Pam's page, you will be cracking up laughing at her polls that she take in her posts. Laughter is good medicine. All right, Tracy, you're up.
Okay, so just to, piggyback off what these wonderful ladies said about knowing your body, knowing your risk factors. As I stated earlier, I worked at the American Diabetes Association for over 12 years, and when I was asked to join the association, I absolutely said, no way, I don't want to go. And guess why? Because I was living with diabetes. I didn't want to know anything about the disease because I was afraid about that word, heart attack or stroke. But guess what? Knowledge is power.
Yes, it is.
So knowing your numbers, self-care is important. And guess what, ladies? No is a complete sentence.
Amen. Tell them again. No is a complete sentence. And last but not least, Queen D.
Yes, I'm going to say this. Get up every day saying, I want to live. Every day, I want to live, okay? Get out there, move, and shake. Do what you have to do. Walk. And as you're walking, you make sure you talk to that man upstairs and thanking him for everything that he has done for you that day. Stay positive. Surround yourself with movers and shakers. Surround yourself with people who's doing better than you. Surround yourself with people who are uplifting, who's going to inspire you, who's going to cheer you on, who's going to tell you that they love you and tell you that you're right or you're wrong, okay?
Yes.
And I'm going to say this. Find a nice, positive place to work out. Meaning spiritual. You can feel it. You can feel it when you go in there, okay? Find yourself somewhere where you can work out. You can be yourself. There's no judgment. Find yourself a sister in that place or brother, and make sure that you two kind of become like accountability partners. Okay, you check on him, they check on you. Okay? I'm just going to say this. Just every day, just wake up saying, I have purpose.
Yes.
Put your hand here. As soon as I'm telling you, as soon as you get up, put your hand here. That's beating. Purpose.
Yes.
You're alive. You're blessed. So every day, just thank him for that.
Yes. Thank you so much, ladies, for being a part of our panel. I'm going to turn this around. Hey, y'all. Yes, that was my voice. So listen, again, the statistics don't lie. 1 in 3 women, 1 in 4 men die annually from heart disease. Every 80 seconds, someone dies from heart disease. Did you know that women are less likely to receive CPR in a public place than men? Okay, I'm going to read you some stats. 2018, the statistics show that 45% of men got assistance compared to 39% of women. And men have a 23% increased odds of survival compared to women. Why is that? Because men don't want to put their hands between a woman's breast. So it's about how we are made. So especially now, that was 2018. Can you imagine now with the Me Too movement? Men are afraid to touch a woman because they're afraid of being sued. They're afraid that they're going to be accused of inappropriate behavior. So we need to spread the word more and more. It's okay. You do need to bare the chest. If I'm having an event, please, for the love of God, touch him between my breasts. If you get your feel on in the meantime, then oh well. But I need you to save me. I need you to save me, bro. Touch me. I need you to save me. So we just wanted to bring this live on Facebook for the people that couldn't attend the event today. We're having some red wine in honor of Heart Health Awareness Month, all of February. Throw on your red. Talk to somebody about heart health. Get in the know. Like they said, know your numbers, know your risk. I know that I'm directly predisposed to heart disease because my dad died at 59 in 2009 on Thanksgiving Day. You know, he was gone, just out the blue. I thought they were calling me to ask me what I wanted on my plate and what I was bringing for dinner. And they were calling me to say, I'm sorry, your dad's gone. So now I am directly affected by heart disease. I have to make sure that I'm watching what I do to not become a statistic like my dad is now, as well as my sister and my brother. So get in the know, talk about it more. The entire month of February, you'll be seeing posts from me and the other ladies about heart health. Get in the know. Don't be afraid to have those conscious conversations. Thanks, guys, for tuning in, and have a great day.